The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Menopause. Even when you're in your prime, its symptoms can create a major challenge. The cure for AIDS, cancer, and other terminal diseases still hangs on the horizon, but new technology may be bringing the horizon a lot closer. When someone has a stroke, it's an all-out medical emergency. It's a brain attack, and it can kill or leave someone permanently disabled. How can you recognize a stroke? How do they treat it? And how can you prevent it? All this today on Today's Health.
In life, we go through many rites of passage. We change physically, mentally, emotionally. Puberty and marriage, just a few of these life transitions. Right now, an estimated 30 million women in this country are going through one particular life transition, menopause. Hello, I'm Kathleen Sullivan, and this is Today's Health. No matter how good we feel, it is tough to face the fact that we're not getting any younger. And it's a real threat to our quality of life when we add hot flashes, mood swings, and other complications.
You're as young as you feel, or so the saying goes. But even if you're in great shape mentally and physically, certain changes in our bodies occur as we progress from one age to the next. For women who reach middle age, menopause represents a biological milestone. It can be a time of growth and newfound personal freedom. But sometimes the transition through menopause can be accompanied by a number of uncomfortable symptoms that temporarily make everyday life a little more difficult.
I was experiencing irregular periods, nervousness, hot flashes.
I was crying a lot for no reason, and I just felt unbalanced.
There are a number of symptoms that women experience during the menopause, and many of the symptoms they have, they aren't even attributing to menopause. The most common symptom is, of course, hot flashes and vaginal dryness and discomfort.
Every woman is different, and therefore, so is her experience with menopause. Some women go through it with very little discomfort. However, the great majority of women do experience some symptoms of estrogen loss.
Estrogen and progesterone are female hormones. Estrogen can help us to protect from heart disease and stroke. Estrogen is also very important in the growth of bones and the deterioration of bones. With enough estrogen, we can prevent and decrease the process of osteoporosis.
During menopause, the ovaries and other glands decrease their production of these hormones. One treatment used to help women through the discomfort of menopause is called hormone replacement therapy, or HRT.
Hormone replacement therapy is just what it sounds like. It's replacing hormones of the body. We're not giving more hormones, we're giving back what the body used to produce in the reproductive stages.
The hormones helped almost immediately. I noticed a definite change in my sleeping habits.
If I did not take the hormones, I would be quite uncomfortable. I would suffer from fatigue, and I wouldn't have the vitality that I am having today. Also, I would experience hot flashes.
Life consists of many transitions. For women, menopause represents one that may be challenging to cope with, but it's not something you have to deal with totally on your own. Medication, support, and therapies exist that can help ease the transition while you get on with your life.
So just what is middle age? You know, you're not a kid anymore, and you're not a senior citizen either. For many, middle age is a time when the children leave the nest and a whole new world of personal freedom opens up. For women, smoothly passing through menopause can help make their personal time their prime time.
Whether your career is on the fast track or you're at a stage where you prefer to kick back a little, the symptoms of menopause can disrupt your everyday life.
If the laundry wasn't dry in the dryer, it didn't dry right, that could set me off for 2 hours.
Fatigue, was entering in. I did for a while feel like I was run down.
Many people associate menopause with getting old, but it happens at midlife. Most women have about 40 more years ahead of them, and those years can often be the happiest, most productive time in their lives.
I experienced more energy, and it was a better way of life for me.
So I'm much more on an even keel. This is much better.
Making the right choices concerning menopause requires information. Women need to understand the benefits and risks of any possible therapies, such as hormone replacement.
It was explained to me that the risks of taking hormone replacement therapy were very minor in comparison to the benefits received.
Taking the hormones far outweighs not taking them.
In the estrogen forms, we can give it by pill, we can give it by patch, there are even injectables. The different modalities of receiving hormones is really geared and tailored to the patient's needs.
One of the nurses that I do work with at this time is using the patch, and she enjoys that better than taking a pill because she said it's easier to apply the patch than to have to take her pills every day.
I'm really excited about the future for the menopausal woman. They're going to be able to be free to talk about things that they never could talk about before. There'll be lectures and group discussions.
Menopause is a natural transition in the life of a woman. The experience of this passage will vary among individuals, but with increased education, awareness, and support, this transition can be the start of an exciting new chapter in a woman's life.
Finding cures for terminal diseases is a race against time. Every day we wait, AIDS, cancer, and other infections claim more lives. But new technology may help us make better drugs faster. Next on Today's Health.
You may have heard the saying, there's always tomorrow. Well, unfortunately, that's not always true. For people stricken with a terminal illness, time is of the essence. And the wait for new drugs to treat their disease can be as torturous as the illness itself. Well, hopefully, some new technology may help us develop better drugs faster.
Time waits for no one. Every second that ticks by marks one less we have on this earth. And when you have a terminal illness, the race against time to develop a cure is a matter of life and death.
Developing drugs to battle complex diseases like AIDS and cancer requires a little bit of genius, a lot of sweat, and an enormous amount of time. Some new pharmaceutical technologies are not only focusing on developing more effective medications, they're attempting to create better drugs faster.
One way a drug can be effective is if it can block an essential step in the disease. For example, antibiotics block an essential step in bacterial growth. Developing drugs that can do this takes so long because it requires an enormous trial and error process.
Drug discovery actually takes, before you're ready to put something into a human, 4 years.
Once a potential drug is identified, the FDA and the developing company put it through testing for about 3 years before it can be approved as safe and effective. That time cannot be avoided.
However, some new research technologies may help dramatically cut the time it takes to identify a drug and bring it to testing. This researcher working for Nexstar Pharmaceuticals is using what's known as the SELEX technology, which stands for Systematic Evolution of Ligands by Exponential Enrichment.
SELEX is fast. We put into this tube 1,000,000 billion different compounds, one with 15 zeros. They are the potential drugs. Another tube might have the target. So if it was HIV reverse transcriptase, you might have that here. And you basically are using the target that you just dumped into the tube as the fishing hook. And you simply fish out and ask, who did you capture?
The molecules that bind to the target tighter become the survivors as the process winnows down the possibilities over many trials.
In theory, the tighter a molecule binds to the target, the lower the dose of that drug will be required. Medicating with lower dosages can sometimes reduce the magnitude of side effects, which are so problematic in current drugs for terminal illnesses like AIDS and cancer.
From the time we start with one of these tubes to the time we're ready to try these things in animals, It could be as short, if you really need it, it could be a month, it could be 2. You're really knocking off a few years.
When will there be a cure for AIDS, cancer, hepatitis? Every day, precious seconds tick away and more lives are lost to these illnesses. We can't just stop the clock, but new technology may help us get more done in less time.
They call it a stroke, but it's really a brain attack. When the vital blood supply suddenly gets cut off from brain cells, it's an all-out emergency. And the faster the response, the better the chance of survival. What should you know about stroke? Get the answers next on Today's Health.
We've all heard of a heart attack, but have you ever heard of a brain attack? It's more commonly known as a stroke, and this serious condition is the 3rd leading cause of death in the nation. It's called a brain attack because during a stroke, the blood flow is cut off from a part of the brain, and it's as severe a medical emergency as trauma or cardiac arrest. If someone asked you if you'd like to save $30 billion, you'd probably say yes without a second thought. That's about the annual price tag for treatment and lost productivity due to strokes. And the sad part is that stroke is probably one of the most preventable medical catastrophes. But the most disturbing fact is that only a small percentage of stroke victims seek emergency treatment, even though early intervention and proper diagnosis can greatly improve chances of survival and recovery.
Well, essentially, stroke is the consequence of interruption of blood supply to a particular area of the brain, where essentially the brain is damaged and that portion of the brain dies and cannot function adequately anymore. There are 2 basic different types of strokes. One involves hemorrhage into the brain. We call that a hemorrhagic stroke, and that can be due to a ruptured aneurysm in the brain. The other type of stroke, which is more common, is what we call ischemic stroke. Ischemic means from lack of blood supply. And that is when a blood vessel to a certain area of the brain gets closed off.
Currently in the United States, there are over 550,000 strokes per year. About 1 in 3 is fatal, and almost as many leave their victims permanently disabled.
Stroke respects no age boundaries. It can strike at any time.
Stroke is the #1 cause of adult disability. Both men and women are at risk for a stroke, and about 75% occur in people who are over 65 years old. After age 55, the risk of stroke doubles every 10 years.
TIA stands for transient ischemic attack, and that's usually due to a little blood clot that is very small, lodges in a little artery in the brain, and then it passes off, so that it results in a temporary loss of neurologic function. TIA is a very, very important warning sign of a stroke, and some recent studies have shown that as many as a third of people who have had a TIA go on to have a stroke within 2 years.
The key to recovery may be the speed of response. Emergency teams and doctors are teaming up to treat stroke victims better and faster than ever before. What are the signs of a brain attack? Why are chances for survival and recovery looking brighter? When we return on Today's Health.
I started racing back in 1928, I believe. I created the Barton engine in the 40s. In 82, I established a speed record of almost 112 miles an hour. I never thought for a minute that I'd ever have a heart attack, and I never thought for a minute that I'd ever have a stroke. I had a stroke which completely paralyzed my right side.
Every day we learn more about stroke, and the more we know, the better the chance of preventing them. If you are in a high-risk group, understanding the factors that increase your risk and becoming aware of the symptoms of stroke may help save your life.
Stroke is a preventable disease in that a number of the risk factors that a person may have for stroke can be modified. One of the most important is actually smoking.
High blood pressure or hypertension is the major stroke risk.
In order to help keep a stroke from progressing to a more destructive stage, it is important to recognize the symptoms and react fast.
The most important sign of stroke is probably numbness and weakness, paralysis in one side of the body or another. Another important sign is difficulty speaking, loss of speech.
Something went haywire. I couldn't talk, I couldn't use my hand, I couldn't move my leg.
His voice was so garbled that I knew that he had had a stroke.
I had no pain and no nausea, no headache, nothing. Only I couldn't use my right side.
Pain, interestingly, is not a common symptom accompanying stroke, and that's very important because when people are hurting, they do something about it.
If you think you are having a stroke or you recognize the symptoms of a brain attack in a family member, call an ambulance. How fast you respond can make the difference between tragedy and recovery.
There is a significant window of opportunity in which physicians and other medical healthcare providers can intervene to do something to hopefully reverse the effects of the acute stroke. In some patients, it's only a few minutes. In other patients, it's probably several hours.
I was in the hospital probably within an hour of the time I had the stroke.
The majority of the patients, if they're not seen and treated within the first 6 hours, the damage becomes pretty much irreversible.
If somebody thinks they're having a stroke, or if somebody is with somebody who might be having a stroke, the best thing they can do to get that patient into the medical system as rapidly as possible is to pick up the phone and dial 911.
Medications that preserve dying brain cells could be a reality in the very near future. Farther out on the horizon, researchers are trying to develop compounds that may help regenerate cells that are already dead.
There are a number of drugs that are beginning to be used now that have been found to be effective to protect the brain against the effects of a stroke. And there are some more modern treatments that are beginning to to be found to be effective that involve dissolving the blood clot itself, just like in the heart, using thrombolytic agents.
The other major type of experimental agents are the so-called neuroprotective agents. The idea is to give these agents very soon after stroke onset so that they will protect the nerve cells in the brain and keep them from dying. And we think that by protecting the nerve cells in the brain and keeping them from dying, we can improve the outcome of the patient following their stroke.
They are testing a new drug for strokes. My recovery was fast, and that's exactly what that drug was for.
The sooner we think we can improve blood flow to the brain and save brain tissue and improve the patient's functional outcome, which means their ability to walk, talk, drive a car, go back to work.
My hope is that within the next 5 to 10 years, the traditional treatment of stroke will be outmoded, and that in its place, we'll now have one or several established new treatments that can be applied to patients in the first hours after stroke to reduce the amount of injured brain.
My hope and vision is that the brain attack will be treated with the same sense of urgency, as I have mentioned, as a heart attack.
I would like to tell anyone, or everyone that may have a stroke, that the new development and technology in medicine can be a great help and let people live a normal life again.
I am very optimistic, and I am convinced that a number of these drugs are going to be found to be effective, and they're really going to revolutionize the treatment of stroke in the future.
What we have to live with. I had an awful lot of drive. I still have. I'm going to walk. Maybe not quite as good. Maybe I can't lead quite the life I used to, but I'm sure going to try.
How was your afternoon? Pretty good?
Excellent. I lost my voice, that's all. It's a good thing.
What here? Honey. Skull.
Okay.
Here's to a better life. A new life.
A new life. It's a mind over matter. If you want to, and if you try and work at it, which I try to do, mind comes out. You win, and I'm going to win.
I'm Kathleen Sullivan. Join us again next time as we get right to the heart of the matters that affect your life on Today's Health.
To purchase a complete written transcript or a videotape copy of this or any edition of Today's Health, write to this address or call 1-800-877-7769.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.